one of my friends asked me, hey, Sam, imagine that there's a swimming pool. It's filled with toxic waste, gunk, just every pus, just everything you do not want to go through. Would you jump in that swimming pool? I said, heck no. Why the heck would I do that? And then he asked me, well, what if it was your daughter or your son or your loved one on the other end of that swimming pool? Would you be willing to jump in there? And of course, the answer is yes. This is the why, the purpose, the motivation.
3, 2, 1, liftoff.
Welcome to the Ketamine Startup Podcast. This is where we talk about ketamine infusion therapy, running a practice, marketing it, and more. And in today's episode, Sam had the opportunity to speak at the American College of Emergency Physicians Scientific Assembly in Las Vegas in October 2024. The talk was titled Opening a Ketamine Clinic, an Unconventional Path for Emergency Physicians. And it's been a little lightly edited for your listening pleasure. We're excited to share this presentation with you. Stay tuned to learn more. Let's dive into the episode.
15 years ago, I actually attended one of my first ASAP scientific assemblies, and Dr. Amal Mattu gave a presentation. And it was not about EKGs. It was actually titled Finding Your Niche in Emergency Medicine. And I believe I was a med student resident back in those days. And for some reason, that presentation really just stuck in my brain about finding your niche. And so today, my niche is ketamine therapy. And the title of our presentation, Opening a Ketamine Clinic. It's an unconventional path for emergency physicians. But I want to tell you all about that today. A few disclosures. I'm going to be talking about ketamine therapy for off-label use, meaning it is not FDA approved for these indications that I'm going to be speaking about. I'm also the founder and medical director of Reset Ketamine in Palm Springs and the co-creator of KetamineStartup.com, which is an online course where I actually consult with other clinicians about opening up a ketamine clinic and just all the intricacies involved with this. A little bit about me. I'm board certified emergency medicine. I'm a fellow of ASAP and AAEM. I have a joint MD, MBA degree. I've had prior administrative experience being an assistant medical director at an ER, also academic experience being an assistant professor, 15 plus years of ketamine administration experience. And as I mentioned, I'm the founder CEO of Reset Ketamine. And I'm also an expert faculty member for the American Society of Ketamine Physicians. This is really my niche. I'm very passionate about ketamine. So I've been featured in podcasts with Rob Orman, like the Stimulus podcast, published articles in EM News, White Coat Investor, documentary on Amazon Prime. So this is really the area that I'm very, very excited about. And today I want to tell you kind of what's been going on and what we're facing. So as you probably know, we have rising rates of PTSD, depression, anxiety, suicide, and these numbers are going up. 1 in 5 people are affected by a mental health condition. So if it's not you personally, it might be the person sitting next to you or someone that you're close with, a friend, a family member. The WHO, the World Health Organization, says that more than 300 million people worldwide are affected by depression. It's also the leading cause of disability. In addition, 17 plus million people are affected by severe chronic pain. And the challenge is that typically SSRIs takes 2 to 3 months to kick in for these mood disorders. And there is a continued opioid epidemic, which you may be familiar with. And as I mentioned with the antidepressants, only 20 out of 100 people actually get better with antidepressants. And there's a host of side effects: GI issues, sleep disturbances, sexual dysfunction, headaches, fatigue, apathy. And when someone is in severe mental health pain or chronic physical pain, well, what's that going to do? It's going to increase the risk of suicide. And this is what we're seeing. The data shows that suicide has actually increased 33% from 1999 to 2017. It is the second leading cause of death amongst Americans between the ages of 10 to 34 years of age. And internationally, 800,000 people die by suicide every year. This little graph here shows the increasing rate of suicide in the United States. And as you can see, There was a little dip in 2020, but again, it's now going up. So it's a really big problem. Now, for emergency physicians and clinicians, what are the challenges that we're personally facing? Well, 65% of EM physicians surveyed report burnout in a Medscape 2023 survey. Also, a lot of emergency physicians are leaving the practice of medicine, and 1 in 10 female emergency doctors left clinical practice, and 1 in 13 male doctors left clinical practice. And so some of the trends that we're noticing is that there is a predicted surplus of nearly 8,000 emergency physicians by 2030. This is from an ACEP policy statement. And as you know, in the emergency department, there's more administrative burden, more corporate practice of medicine, decreased reimbursement rates, less autonomy for the physician. So I assert that we are uniquely positioned as an emergency physician to address these trends. So we have ketamine therapy in this Venn diagram. We got alternative career paths, and then your unique emergency medicine training and skills. And now I want to shift into IV ketamine therapy. We're going to go over some of the scientific studies and the mechanisms of action. So ketamine was FDA approved in 1970 for use as a general anesthetic by the FDA. After 30 years of that, in 2000, Dr. Berman and his colleagues published a very small sample where they used IV ketamine, 0.5 milligrams per kilogram, slowly infused over 40 minutes, and compared that with a saline placebo. It was randomized, it was placebo-controlled, double-blinded. And they took 7 patients and just said, hey, let's just see, as a proof of concept, is this even going to work? And if you look at this graph here, on the y-axis, you have the change in the depression scale and then their time. The black circles represents the ketamine treatment. The open white circles represent the placebo. And what they found in this study was that it significantly dropped the rates of depression in the patients receiving IV ketamine. And since that point in 2000, it's 2024 now, so 24 years later, there's been multiple trials. And as you probably know already, we'll take all of these small studies, put them together and create a meta-analysis. And this meta-analysis published recently looked at about 10 years worth of data. And bottom line, they found that yes, IV ketamine can be effective for depression. And most recently in May 2023, in the New England Journal of Medicine, they compared IV ketamine versus ECT, electroconvulsive therapy. So you probably know this already. ECT is the gold standard for treatment-resistant depression. And they were curious, hey, can IV ketamine work? And in this study, it was nice because they were 400 patients. So quite a large sample size, 200 in each arm. And what they found was that ketamine was considered non-inferior to ECT. So just as effective as ECT without all of those side effects of memory loss, cognitive issues. Later, this was published June 25th, 2024 in JAMA Psychiatry. So fairly recent, just a few months ago. They took that same data and did a secondary analysis. In the secondary analysis, they concluded these results suggest that outpatients and those with moderately severe and severe depression may consider ketamine over electroconvulsive therapy for their symptoms. Next, let's look at the data for anxiety. So this was published by Dr. Paul Glue out of Australia, and they were basically using increasing doses of ketamine. So they had 12 patients who suffered from generalized anxiety disorder, social anxiety disorder, panic attacks, people who had already tried various SSRIs and psychotherapy. They gave them escalating doses of ketamine, 0.25 mg per kg, 0.5 mg per kg, or 1 mg per kg. And what they found was that overall, 10 out of those 13 patients, so 83%, reported a greater than 50% reduction in their Hamilton anxiety scores or fear questionnaires. And these results lasted not just during the time of when they were receiving it, but for 3 days, 7 days. And they found that the multiple infusions also helped prolong the duration of ketamine effects. I also want to tell you a little bit about PTSD, post-traumatic stress disorder. This was a randomized, it was a proof of concept study. They were published in JAMA Psychiatry 2014. They did just one infusion, 0.5 mg per kg of ketamine over 40 minutes, or midazolam. So that's an active placebo. And in this study, the squares represent the ketamine's arm, and then the triangles represent the active placebo. And again, they found that there was significant improvements for those patients receiving IV ketamine. Later, that same group of doctors, they did a bigger, kind of longer study where instead of a single infusion, they actually gave them 6 infusions. And in this study, again, it was compared versus the active placebo, midazolam. And if you look at the graph here, again, they found that in their clinician-administered PTSD score, the orange circles represent the ketamine and the midazolam is the green. And again, a significant improvement in PTSD symptoms for those patients suffering. Regarding chronic pain, when I say chronic pain, it includes so many things, but what we've seen is that it's more effective for patients, especially chronic, with neuropathic pain or pain related to central sensitization. So some examples of that: complex regional pain syndrome, also known as reflex sympathetic dystrophy, trigeminal neuralgia, fibromyalgia, postherpetic neuralgia, peripheral neuropathy. And for chronic like osteoarthritis, bone-on-bone knee osteoarthritis, I haven't seen it to be as effective for that mechanical type, but more for the nerve-related. And this meta-analysis was looking at ketamine infusions for chronic pain, systematic review meta-analysis published by Dr. Ohuru. And what they essentially found was that the benefits lasted up to 2 weeks after the use of IV ketamine. They synthesized and said that the higher the dose and the longer the duration of the ketamine, the more effective it was. And they hypothesized that it was due to kind of resetting the pain receptors as it's blocking the NMDA, which is involved with neuroplasticity. So their bottom line was that on a case-by-case basis, yes, IV ketamine can be used effectively for those patients suffering from chronic pain. Now, there's been more than 140 clinical studies looking at ketamine as a treatment for mental health conditions. And so you may be wondering, well, how does ketamine work? You probably already know this. It is an N-methyl D-aspartate receptor antagonist blocker, and it works on the neurotransmitter glutamate. Glutamate is an excitotoxic neurotransmitter, and it actually comprises 90% of the neurotransmitters at the synapses. So you have dopamine, you have serotonin, you have norepinephrine, but the vast majority of those neurotransmitters are glutamate. And we believe that by blocking the NMDA activity, that it's actually responsible for the analgesic as well as the anesthetic effects. Ketamine is not one of those drugs where it just works on one receptor, but a host of receptors. So it's working on the opioid receptors, the dopamine, serotonin, acetylcholine, GABA, nitric oxide. So it's not like if we think about a selective beta blocker where it's just working on, the beta 2 agonist, but it's working on a host of all these other receptors. So studies have shown that chronic stress, whether that's related to depression, anxiety, PTSD, chronic pain, actually creates extracellular glutamate to go up, which creates excitotoxicity, which in turn leads to dendrites, the neurons, retracting. It leads to dendrite arborization and spine density decreases. And ketamine has the potential to reverse all of this through something called BDNF. So it increases brain-derived neurotrophic factor, which increases protein synthesis, synaptic strength, and synaptogenesis. And the bottom line for that is that it's going to create neuroplasticity, reopen critical learning pathways, and resets pain receptors. But studying neurons to understand consciousness is like studying letters to understand Shakespeare. And what I mean by that is one of the side effects of ketamine may be those hallucinations. And so maybe it's actually not a side effect, because Dr. Eli Kolb, who published a paper on the different experiences that someone can have when they're getting ketamine. So some people can report empathogenic experiences where they feel comfortable, their ego defenses are reduced. They may have these non-specific visual patterns. At higher doses, they may even have out-of-body experiences where it feels like their body, their ego is dissolving. Near-death experiences. Some people can feel like, hey, I just did a ketamine. I feel like I died, as well as ego-dissolving transcendental experiences, which I would say is a fancy word for like mystical or spiritual experiences, maybe connections with God, sacredness, universe. Now, for those people who are EM trained, we have a pretty unique skill set in this space because we already use ketamine. I think the vast majority of people in here have administered IV ketamine. So we're very familiar with it, with how to use it, the adverse effects, side effects. We also have experience dealing with patients suffering from depression, anxiety, suicidal ideation, chronic pain. We're also very comfortable with doing procedures, monitoring patients when they're getting sedation, vital signs. And also what's unique for us is that we have flexibility in our shifts, right? We can pick up more shifts. We can do less shifts. We can sometimes create our own schedule, which allows you time to create these side gigs, such as a ketamine clinic, and open up a private practice because of that flexibility. And I want to remind you that emergency medicine is not a location. It's a mindset. So I looked at ACEP and the various sections, and we have cruise ship medicine, urgent care medicine, disaster medicine, hyperbarics, toxicology, forensic. So your unique skill set as an EM physician and clinician, it doesn't have to be isolated to, it just has to be delivered in this one specific area.
If you tuned in to our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with a valuable resource. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast.
So you're probably curious, well, this is really fascinating. How do I even get started? But I would say ignoring everything and just putting the how aside. The most important thing is your why. Why are you doing this? And this is going to motivate you. It's going to be part of your clinic. It's going to be part of your branding. So really knowing, why am I even starting this adventure? Because opening up your own practice is hard. There's going to be paperwork. Business might be slow. You might not get a lot of patients at first, 3 to 6 months, and you're worried about cash flow. Or your colleagues who are not in this room, they might say, hey, what are you thinking, Paul, Julie? What the heck are you guys thinking? You guys are out there, get back in the ER. So you're going to face challenges, I promise you. But if you have a strong enough why, it's going to get you through that. One of my friends asked me, hey, Sam, imagine that there's a swimming pool. It's filled with toxic waste, gunk, just every pus, just everything you do not want to go through. Would you jump in that swimming pool? I said, heck no. Why the heck would I do that? And then he asked me, well, what if it was your daughter or your son or your loved one on the other end of that swimming pool? Would you be willing to jump in there? And of course, the answer is yes. This is the why, the purpose, the motivation. Now, with ketamine use, it is not covered by insurance, meaning it's cash pay. So some people may think about ketamine clinics and just say, hey, man, I'm just going to go make a bunch of money. It's going to be so easy. But I want to let, for full disclosure, it's challenging because there's no clocking in and clocking out. When I worked in the ER, go to my shift at 12 p.m. and at 8 p.m. and be done, and I would be free from it unless I'm thinking about, should I have CT scan that patient? But it's not like that. The ketamine clinic is going to be constantly on your mind. It's like having a newborn. And from the financial perspective, you can actually probably make more just working full-time emergency medicine, because those hours that you're thinking about marketing and HR and staffing, like that is not compensated time. And when you're ordering gauze and syringes, like that's all uncompensated. So don't do it for the money is the bottom line for this slide. On the other hand, well, why should you open up a ketamine clinic? For me, I really valued freedom, autonomy, flexibility, creating my own schedule. I really felt like doing this work was part of my purpose and mission in life. I loved the cutting edge medicine, like anything that's on the forefront, whether it's ketamine therapy or stellate ganglion blocks, like anything cool, cutting edge, that's really my purpose. And it's saving lives. I know we've all saved lives in the emergency department, but this is a very unique niche way to actually save lives, because I had mentioned about the suicide rate that has been increasing. So some of the patient quotes that came up from, and I've been open for about 6 years. One patient told me, ketamine therapy for me was a key that fit a lock that needed unlocking. After receiving my 6 infusions, I am able to self-soothe in places inside me that before my infusions were critical, self-abusive, and despondent. Another patient told me, I've been in therapy for 2 years and I tried a couple of antidepressants, but nothing helped me turn off that chatter in my brain like ketamine. Another patient reported, I used to feel like life was a giant boulder in front of me that I was struggling to push up a hill. I was exhausted and I was brought to my limit. I now feel like the boulder is much lighter and actually look forward to pushing it. And finally, another patient writes, after years of uncovering my trauma and trying other treatments for PTSD, I pursued ketamine because I was sick of these Band-Aids. I wanted to pursue actual healing and reset my neurological system to eliminate my daily struggles with triggers, and it worked. So once it's open, it is the most emotionally nourishing, gratifying job that I've ever had. And I'm really fortunate because I get to work with these patients and help them and make an impact and save lives. I've literally had patients who said, hey, if a year ago, if I hadn't pursued this, I probably would not be here today.
We hope you enjoyed today's episode. If you enjoyed this and our podcast, please do us a favor and give us a 5-star rating on Apple Podcast or the podcast player of your choice. And we will see you in the next episode.